in medical school, you're taught to look for the common things. They call it look for the horses, not the zebras. But of course, in rare disease, we're the zebras, right? So it does take a while for patients to come to diagnosis. On average, sometimes it can take 12 years from symptom onset to diagnosis. And I think it's because there's a lack of awareness to really think about patients that have recurrent infections, because some of the recurrent infections can be with common bugs. It's just that they happen often and they're difficult to treat. So, creating awareness in the community amongst patients to ask the right questions of their primary care providers in getting referrals to specialists or getting certain laboratory testing. Also, educating our own colleagues in primary care and other specialties that these patients are going to show up in their clinics. And so, for patients that have these recurrent, refractory, or are odd presentations of immune disease, they should be thinking about primary immune deficiency. And then also, the last piece of that is to create awareness within our community leaders and our government officials to make it easier for patients to get the care that they need, the diagnostic tests, and then the right treatments and make them available to all patients equally. Well, first, I'll tell you that anybody can get this rare disease. There is no distinction by age, race, gender, geographic location. It's characterized by mostly recurrent infections. So, patients that have either recurrent infections that don't really respond to one simple course of antibiotics, or they have infections with very rare organisms or bugs. So, rare fungal infections or things that are seen in the environment that you and I, with normal immune systems, don't really have a problem with. But patients with primary immune deficiency can't get over them, and they cause a lot of uh, respiratory problems, GI problems. Patients can get infections anywhere in the body, in the lungs, in the GI tract, on the skin, in the liver, even in the brain, and the eyes. So it's really important to pay attention to those signs and symptoms. Um, and so I think that it's really um, most of the signs and symptoms are recurrent or infections that don't get treated very easily. But patients can also have autoimmune symptoms and inflammation symptoms if something is not functioning properly in their immune system, or if pieces of their immune system are missing. And a lot of these are inherited. So patients are born with them or have problems in the genes that affect the immune system. So they might be hardwired to the patient, and identifying it early and getting to the right physician to help work it up and get the diagnosis can actually lead to better treatments and a better quality of life.